Thank you, Speaker. My question is to the Acting Premier. My community is reeling from this government's decision to pull $20 million more from healthcare in my community by saddling local hospitals with the cost of a forced merger of Ajax-Pickering Hospital with Lakeridge Health. That will mean fewer hospital beds, fewer nurses, longer wait times, and more cuts to patient care. Thousands in my community have signed a petition calling on the minister to reconsider this decision, but instead of listening, the minister is ploughing ahead. How does this government expect our local hospitals to find $20 million to pay for this forced merger without cutting patient care?
Thank you.
Minister of Health and Long-Term Care.
Minister of Health, Long-Term Care.
Well, thank you, Mr. Speaker. I'm very proud of the work that's been done over the past year and a half by community members right across Scarborough and across Durham as well. And I referenced, I think, last week the $20 million investment in the Scarborough Hospital, the $10 million investment, I believe, for a new emergency hospital at Rouge Valley. And when it comes to Ajax-Pickering, just last week I made the announcement that, quite the opposite of decreasing services, I provided guarantees in terms of the sustainability of the services that are there, like the shoulder program. I actually announced that there would be 20 new mental health inpatient beds at Ajax-Pickering Hospital. Those beds that were taken away previously are coming back to Ajax-Pickering. I also indicated that the name of the hospital is going to represent the local community. Those investments that they've made in assets that the foundation has generated the funds for, all of those things are going to continue, and the services are going to continue to improve, Mr. Speaker.
Thank you. Supplementary.
Thank you, Speaker. The minister is talking about community and has talked about consulting with the community, yet the community doesn't feel like they've been consulted at all. In fact, members of the community are here today to make their voices heard. Last week, the minister quietly signed the integration order for the merger, something he neglected to mention when I asked him during question period that same day. Did it slip his mind, or is it just another example of how this government has tried to ram this through as quickly and as quietly as possible? This is death by 1,000 cuts. Or really, it's more like death by almost 20 million cuts. Will the minister please listen to my community and prevent the damage he could be doing to our local hospitals?
Thank you. Minister.
Well, I hardly see how issuing a press release announcing the integration is doing it quietly, Mr. Speaker, because that's what I did when I announced the 20 new inpatient beds, when I talked about the importance of sustaining the services that are there. And I think the member opposite needs to speak to the community and the representatives of the community, including the Friends of Ajax-Pickering Hospital, who I met with 2 weeks ago, who I spoke again last week as well, who are very satisfied with the approach that we're taking and in agreement with the safeguards and the measures that I took place.
Order.
If she would stop talking and actually listen to my response, Mr. Speaker, she would understand that the community actually is confident that the steps that we're taking are going to preserve and, in fact, enhance the services at that important local community hospital.
Thank you. Your question, the member from Beaches East York.
Well, thank you, Speaker. My question